Hi everyone, my name is Leanne Bradshaw. I am the assessment coordinator here at the Kittitas County Public Health Department. I'm going to briefly talk about data and go over some of the metrics that we use to monitor COVID-19 activity here in Kittitas County. Before I get started, I just want to remind everyone that it's important to make sure that you're getting your data from a reliable source and that you're checking the time and date your data was published or updated, and that it's just remember that it's really important to interpret the data correctly. It's also important to understand that data changes, and it changes because we need to incorporate new evidence as soon as we're able to. And in response to those changes, our data and estimates also change. So we're constantly adapting, staying updated on state metric changes so that we can get the most accurate data. So as you can see on my screen, I have the state risk assessment dashboard open, which I hope many of you are familiar with by now. The first metric I'm going to talk about is the cases per 100,000. This is a metric that everyone's been talking about, and it's also really important for school reopenings. So this is a metric that the Department of Health uses to measure disease activity within the state and also within each individual county. So we use the 100,000 to represent the general population, and also in order to be able to bring each county down onto an even playing field so that we can compare them more easily. We count the number of cases reported in the last 2 weeks with a 10-day lag period, divide that by the population of Kittitas County, and then multiply that by 100,000. We use that 10-day lag period because we realize that the data for the most recent 10 days is incomplete. The Department of Health typically has less than 90% of results within the prior 10 days, so that's why it's important that we use that lag period. So let's say, just to try to explain this metric a little bit more, let's say we look at King County and Kittitas County, and there's 2,000 cases in King County and 2,000 cases in Kittitas County. So 2,000 cases in a population of 2.23 million is going to be a lot different than 2,000 cases in a population of 47,000. 2,000 cases in King County is still concerning, but a small amount in such a large population. 2,000 cases in Kittitas County would be a really big problem. So this is why we can't necessarily use case counts as the only way to measure disease activity. And this is why we convert it to a per population metric to measure disease activity. The next metric on the risk assessment dashboard is the average daily COVID-19 testing rate per 100,000 over a week. It's basically the same thing as the cases per 100,000, just using the number of tests we performed. The percent of positive tests over a week, this is just a measure of how many tests are coming back positive. The Department of Health set this metric to 2% or less. The higher the rate, the more tests we have coming back positive. And we calculate this by taking the total number of new cases, dividing it by the total tests for a certain time period. The healthcare system readiness metrics, this is the percent of licensed beds occupied by patients and percent of licensed beds occupied by COVID-19 patients. And this is just to see how our hospitals are doing. Are they nearing capacity? Are they well past capacity? And this information is reported directly from the acute care hospitals. Another piece of data that I'm going to share with you that we have to collect are our case and contact investigations. So we keep track of if our cases are reached within 24 hours, and if the contacts were reached within 48 hours of a positive lab report. And then everyone knows by now that we have to call cases and contacts daily during their isolation and quarantine period. And we have to keep track of each of those calls. So were we able to contact those cases and contacts? Did we attempt to contact them? We're just not able to contact them for some reason. So here are the targets that the state has set for us, and we typically meet those targets each week. And so I hope that helped explain the data and the metrics that we use here at Public Health, and that you have a better understanding on why we use them and how we get those numbers. So thank you.